All right, guys, this is Sean. Sean, he's a colon cancer survivor. He's going to give us a little bit about his story.
Yeah, g'day. So I'm calling from Gold Coast, Australia. And Warren was awesome enough to hook me up. We met up through Instagram. And basically starting to do this chat. So I've got some notes here, so I will be looking at them. But
Cool.
basically in Australia, we usually start with an welcome to country or an acknowledgement of country. I'm based in Yugambeh country in Australia, which is the Indigenous owners of this place, and pay respects to my elders past, present, and emerging. There's a lot of good young folks coming through. And so basically, who am I? I'm a GP, which is like a family med doctor based in Australia. I'm 35 years old, no history of bowel cancer, no history of Lynch syndrome, nothing else like that going on. And I've recently been diagnosed with stage 4 colon cancer, which is pretty interesting as a doctor. I'm sitting on the other side of the fence now. So basically, how it all started for me was I was sitting exams last year, working full-time, studying full-time, surfing 5 days a week, pretty fit and healthy, and started to get sort of like fatigued and feeling a bit weird. And I started to think, hey, what's going on here? Went to see my GP, they did a whole bunch of blood tests and said, maybe you're getting depressed. I thought, hey, that's probably pretty true. So I started on some antidepressants. And
So the first thing happens is you're fatigued and they say you're depressed and they just put you on meds.
That's correct. So, and basically, my bloods were all normal. So I did a full range of blood tests, and my hemoglobin was like 148 or 150, something like that. So really high. You wouldn't have thought bleeding or bowel problems at all. And so basically tried that for 6 or 8 weeks. Wasn't working for me. I thought, I'm just going to get off these medications, and still was dealing with fatigue. And when I first really noticed that there's a river that we paddle across to go swimming at a surfing site, I got halfway across the river and felt dead fatigued, like I've never, ever felt before. And I was like, man, I've got to get out of this. I've got to get out of the water or I'm going to, basically get stuck here. And it was something that was quite unusual for me. And I was just like, shit, something's really wrong, basically. So after that, I sort of put things on the back burner. And I probably should have done that in retrospect, but the main reason was I had a big exam in November. So studying $6,000 exam, lots of stress. I was like, I'll just get through the exam, just get through the exam. So by September, I was starting to get sort of like weird abdominal pain, increasing frequency of doing poos, which is another common sign. So if you get lots of diarrhea and have trouble passing hard poos, that can indicate that you've got something going on in your bowel. So bowel habit change in any way can be sort of like one of the symptoms you got to look out for. And so I basically then just pushed through that. And then in October, late October, a couple of weeks before I was diagnosed, I started to get a bit of blood in the stool, a bit of mucus in the stool. And I thought, oh shit, I've got Crohn's disease, I've got ulcerative colitis, I've got one of these sort of inflammatory bowel disease.
So there's so much that goes to your brain, I guess. I mean,
yeah, exactly. Well, I'm a doctor, so I start thinking like logic, blah, 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 blah. Now they say that a doctor who treats themselves as a fool for a patient, and I was a fool because I didn't go back in September. I put it off for 2 months. So basically got through my exam, passed it. And then so I had my exam November 11, went and saw my GP the next day. So I had my own doctor who I see regularly, and got a colonoscopy on Friday, the 15th of November. And that's when everything changed. They're like, it's not ulcerative colitis. A nurse walked up to me, and I'm sure lots of people are familiar with this thing. She said, you better wait for the doctor. And then she gave me this pat on the hand. I thought, oh dear, this is something serious. Yeah. So, you know that feeling, you can just see it in the healthcare worker's eyes. She couldn't tell me, but she was like, yeah. And I was like, oh man. So the doctor came out, and I'm sure a lot of people have had that experience. And nurses are the best. And so the doctor came out and told me, hey, you got really big cancer. We can't even get a scope past it. It's completely blocked your bowel off, and we need to get onto this real quick. So I had CT scans, and by the next Friday, I was in theatre. And they weren't able to take my tumour out. It was too far progressed. It had grown in really close to like the bone in the back of your spine there. It's called the sacrum, like in the part of the pelvis. Mm-hmm. So I was a bit too close to that. So they said inoperable, and we'll just hammer you with chemo. So the plan was then my oncologist became really important. And so basically after that, got onto the chemotherapy, got a whole bunch of opinions from around the country, like I say, 3 doctors, 4 opinions. That's exactly what I got. I got 3 doctors, and I pretty much had 4 opinions, and it was left in this and they were completely opposite. 1, 2, 3, like 3 sides of a triangle. It's like, I'm in the middle. Right. What do we do? So it can be very frustrating and confusing. And that's for me as someone who's medically trained, it was still really complex. So from there, I basically had a chat to my treating oncologist, and we decided, look, let's just keep going with the standard therapy, the really baseline therapy, and we'll see how you go at 3 months. And I was lucky. I got a very good tumor response to baseline therapy. So at the moment, I'm on a medications called Folfox and cetuximab. So Folfox is a combination of oxaliplatin, which is a platinum-based drug, causes lots of nausea and vomiting and quite a lot of side effects with peripheral neuropathy. And then the other one's called 5-fluorouracil, which is a drug that can basically, it kills cancer.
So the Fluorouracil, do you do it 48 hours, or do you only do it? What's your regimen?
Yes. So I get a 3-day regimen. So basically, day one, I get the oxaliplatin, Folfox, so the 5-FU. Then I get stuck onto a pump, like a little pump for 2 days, and they give me a booster dose on the middle day. So usually it's Tuesday, Wednesday, and then Thursday's pump off day, which is the best day of the cycle. Because having a needle hanging out of your chest is always fun, as everyone here can attest to. Having a shower, man, that first shower, once you get it out, you're like,
yeah. Well, I'm a rebel, so I was like, oh, you can't take a bath. I was like, what? I mean, you can't take a shower. So I can take a bath. They said, oh, you can't take a bath. I said, well, what's the worst that can happen? Said, the pump gets wet, so I throw the pump because the line's long. I throw it across the floor. I said, well, problem solved.
Totally. So yeah, I generally have like a little bit of a bird bath, just like get cleaning the parts that are important. But yeah, everyone knows that feeling. You get it off and you're just like, oh.
So how is it looking? I mean, what's happening with the cancer? Is it progressing? I mean, or is it responding well to the treatment?
So the first 3 months check that I got responded really well. And so I had an 80% reduction in my tumor burden, which is fantastic. So now I'm on mission to remission. I'm trying to get to NED or no evidence of disease.
Will they be able to remove it now?
So they've spoken to a surgeon since, and it's been downgraded enough that they're going to give it a crack. So hopefully when I'm off chemo, so the plan is now I'm on my last round. So this is it, 12 rounds under the belt of 5-FU. And so I've had a bit of experience with a few of the symptoms, so I can give you some chats about that later. And so basically the planning is from here, finish this round, and then on to some scans and see where it's at. Hopefully after that, I'll come off chemo for a few months and then get operations, and I'll take out. So I have a tumor in my liver. I'll take that out. And I have the main tumor in my bowel, and I'll hopefully take that out at the same time.
Is it both lobes or just one in your liver?
Just one, so I was really lucky. So they should just be able to take half the liver.
And it only spread to your liver, and that's it?
No, so it spread up the lymph nodes in next to my aorta, which is the big blood vessel that comes down. And so there's quite a lot of lymph node tissue around my pancreas and all these other spots that are pretty tricky to get to. So it might be, after all this is done, a bit of radiotherapy as well, just to zap those.
But overall, it's a really good prognosis right now.
Overall, it's a fair prognosis. I've gone from very poor to fair, so I'll stick with fair, man. Like, I reckon we'll get to remission.
I mean, I'm glad to hear that. It's good news.
And man, modern medicine and faith, and having a positive mindset, I think, is honestly the core part of, because there's a lot of evidence around, a lot of medical evidence that decreasing stress improves cancer outcomes. And so the more relaxed you can be, and a part of that for me is just having faith that I'll get through this, and knowing in my heart that I will, and then having a positive future image. So I don't have any children yet. So for me and my wife, obviously, oh my God, you've got metastatic incurable cancer. It's like, yeah, no, we're still going to plan for a family. And that gives us strength and sort of just really focus what's important in life, because we've all been about careers and, getting stuff sorted. But now it's like, what's really important? And so having that positive future regard, I think, is essential.
When something like this happens, it gives you a better perspective on life and what's important, what's not important. And, there were things that I thought that were important that I realized they just aren't. And so,
totally.
I'm very optimistic for you. I'm happy for you, man. And, I want you to have a huge, big family. And, having that optimism helps so much, because, it's not the end of the world. And I think when you first hear this news, it's the end of the world. But if you're fighting, anything could happen. I'm so
and one of the things about bowel cancer is that there are people who get into remission and stay that way for a long time. It's coming that probably in the next 10 or 15 years, bowel cancer will be a chronic disease like diabetes or any of these other things. You got to watch out for it. You got to keep on top of it. You got to keep in control of it. You've got to take meds for it, but people can live through it. And I think that's really, really, really promising. And that's thanks to, a whole bunch of medical science.
That's leading into my plan. And so as of now, I've talked to doctors, I've talked to patients, but I've never talked to a doctor patient. So yes. That's awesome, is that I've got a doctor patient. And so you're looking at both sides. And,
Yep.
I try to tell people, I don't blame my doctor for not finding it,
Yep.
because the symptoms don't lie out the same way.
No.
Like, I mean, even the fatigue, I was fatigued as
Yep.
well. And talking to you and talking to some other people, months ago, actually, we started talking about fatigue and treating you for depression. And then you realize, it wasn't depression.
Yeah.
So
because basically the drugs don't work and the psychology doesn't work. It's just
the
you
medicine
just can't
doesn't
get
work.
out of bed.
And I was thinking, one of the biggest things was something I learned is that your gut is another brain. That's your second brain. And I didn't
Correct.
realize that all of your serotonin is there.
Mm.
And so any medicine they would have given you for depression, whether it be Wellbutrin, Prozac, Seroquel, anything, all of those things help with serotonin, the production of serotonin. But if you have cancer there and you have problems there, how are you going to increase your serotonin if you just don't have the stores, or there's something physically wrong? And I think that's one of the symptoms that I've learned from you guys, just talking to other people, but as well as talking to others. And it's something that I want to try to get out there, because that's something that I think doctors need to look at as well.
Absolutely. And so as a family practice, as a family physician, I guess you'd call in the US, basically we get completely undifferentiated patients. And, but you've got to play the numbers game. So, 35-year-old male, overworked, overstressed. So again, I completely understand why my doctor did what they did. And then I was naughty because I ignored symptoms. Because I was treating myself, I was like, oh, this is just X, Y, or Z. It wasn't. But, potentially if I'd gone back earlier, my GP would have done the test earlier. But realistically, I spoke to my oncologist and he said that the degree and the spread of my tumor, it's probably been there for 5 years. And it's realistically probably been spreading for at least a year. So even if we caught it 2 months ago, it wouldn't have changed a thing.
Right.
So that was really reassuring for me to hear, is that I didn't, put myself in risk by waiting.
Those symptoms that we get them so late on that I was talking to the epidemiologist, and she was like, most colon cancers are really, really slow growing. And so you've been dealing with it for years and years and years and just never noticed it. And then I started going back, and that's when I started looking at these symptoms. I said, you know what, for 4 or 5 years, I've had very small symptoms, or what I thought might have been signs that was something different. And so that's playing into, just knowing your body. And it sounds like you're really in tune with your body, but you were under a lot of other stresses and other things that you were